Hi, welcome. I'm trying to learn medicine. Today, appendicitis, and after we've done it, we're gonna do backstretching. And if you participate in the backstretching, then it's well at your own risk. And this is about diseases and internal anatomy. And this is no medical advice, we're just learning. Now, in one of the previous parts, we talked about the tricuspid valve. And I say the position wrong. The tricuspid valve is on the right side from the heart scene, between the right atrium and the right ventricle. The mitral valve is on the left, between the left atrium and the left ventricle. And the atrial septum and the ventricular septum, maybe I said it also not right, they are just here between the right atrium and the left atrium, the atrial septum and the ventricular septum between the right ventricle and the left ventricle. And they are closed. They should be closed, otherwise it's a septal defect. So the tricuspid valve is on the right side. Tricuspid between the right atrium and the right ventricle. Tricuspid. Mitral on the other. Now, appendicitis. That is an inflammation of the appendix. Of the appendix, long, blind tube arising from the beginning of the large intestine. No, from the stomach there comes the small intestine and the large intestine, and at the beginning of the large intestine there's this little thing. You see it? 3 to 4 inch, 7 to 10 centimeters long blind tube, do we think? It's actually that long. Okay, from the stomach there goes the small intestine and then the large intestine. At the beginning of the large intestine there is this appendix. There are two kinds of appendicitis. Acute, which strikes suddenly and usually requires immediate hospital admission for an operation to remove the appendix, and chronic, which may continue for months before an operation is necessary. Okay, acute appendicitis. Symptoms. These may develop over 4 to 48 hours, so over few hours, just 3, 4, 5, 6 hours, but up to 2 days. The first sign is usually pain that comes and goes. At first it may be felt near the navel or sometimes only in the lower right side of the abdomen. I think the navel is the belly button and the lower right side from here. After a few hours there is severe constant aching in the lower right side of the abdomen, which is tender to pressure. The pain is worse on moving and may interfere with sleep. Okay, the symptoms develop over a couple of hours, 4, 5, 10, 20, 40 hours. And there's pain coming and going, usually at the beginning, and when it is felt near the navel and more on the right side of the abdomen. Then after a few hours it gets severe and constant aching. The patient feels sick and may vomit. There's often constipation, but sometimes the bowels may be loose or normal. I don't know what constipation is. But sometimes the bowels may be loose or normal. Food and drink are usually refused. It may hurt to walk around or to pass urine. Okay, here was already moving. The pain is worse on moving and may interfere with sleep. It may hurt to walk and also to pass urine. There may have been a previous similar attack of pain that subsided. I want to know the cause. Why in that case it subsided. The breath may be foul smelling, so foul smelling breath. Maybe. The temperature usually rises moderately up to 39 degrees Celsius. In children, high temperatures may be noted. Duration. An immediate operation is usually needed, after which patients are discharged from hospital within 1 or 2 weeks and can go back to work after 3 weeks. Okay, an immediate operation is necessary, and then 1 or 2 weeks in hospital. Sometimes the pain will stop after a few hours, but patients should never delay seeking medical help if appendicitis is suspected. Okay, if there is pain coming and going, and after developing of a few hours, 4, 10, 20, 1 or 2 days, after a few hours, just 4 to 48 hours, then a severe constant pain on the right side of the abdomen to the navel. Causes. The open end of the appendix becomes blocked by kinking, swelling inside the walls, or by a hard mass of fecal material, and infection flares up into an abscess. I don't know what kinking is. Blocked by kinking, with a swelling inside the walls, or by a hard mass of fecal material, and infection flares up into an abscess. Complications. The abscess may burst, spreading the inflammation all over the abdominal cavity and causing peritonitis. Sometimes the appendix bursts and the spread of inflammation is localized to the appendix area. This is an appendix abscess. So again, sometimes the appendix bursts and the spread of inflammation is localized to the appendix area. This is an appendix abscess. Whatever, an appendix abscess. Treatment in the home. Let the patient lie still with a hot water bottle to ease the comfort. To the hot water bottle to the abdominal pain, not to drink out. Do not give food or drinks. Do not give food or drinks. The mouth can be rinsed out with sips of water only. So not eat. Because already food and drink are usually refused, and do not give any food. Let the patient lie still. Do not give any pain-killing tablets, laxatives, or any other medicines. So not give medicamentation, but if appendicitis is suspected, ban, what's it? Whatever I said, you should call a doctor. Never delay seeking medical help if appendicitis is suspected. When to consult the doctor? If pain has persisted for more than 4 hours. But call the doctor earlier if the pain gets worse, becomes continuous, or keeps the patient awake. Diagnosis of acute appendicitis is always difficult because the symptoms are so variable, so an immediate medical opinion is essential, especially in children and the elderly. Okay, by saying after 4 hours of pain in the right abdominal side or to the navel, you should seek the doctor, but also earlier if the pain gets worse or is continuous. And by children, even maybe a bit earlier, because it's a bit problematic to assess it, and it has to be immediately operated. What the doctor might do: send the patient to hospital immediately for observation or surgery if acute appendicitis is suspected. Okay, if the appendicitis is suspected, then it comes into the hospital because a surgery is necessary. Occasionally, if the diagnosis is in doubt or the pain has cleared, the doctor may decide to observe the patient at home. Yeah, if it was not appendicitis. I would like to know if what more profound possible things exist to check if it is an appendicitis from the outside. Prevention, none. Outlook: with early observation leading to early diagnosis and treatment, the outlook is excellent, I say. So early observe it if there's for few hours, just 2, 3, 4 hours pain, and then directly to the doctor and to the hospital in the operation, then the outlook is excellent. Recurrent attacks of acute appendicitis arise if the appendix is not removed. Yes, what happens if it's not removed? But it seems pretty serious. Okay, whatever. Chronic appendicitis, a condition in which the patient feels bouts of vague discomfort in the right lower abdomen. What are bouts? B-O-U-T-S. Often for some months, although acute appendicitis rarely develops. Okay, there is the rarely developing chronic appendicitis, and there are bouts of vague comfort in the right lower abdomen cell. Often an operation is performed to see if there are other reasons for the discomfort. Now I want to know, are there any possibilities to see from the outside if the appendix is inflamed? But rarely are any found. The appendix is usually removed, and in most cases the symptoms disappear. Okay, in short, if there is over 2, 3, 4 hours pain in the right side of the abdomen or to the navel, then see a doctor. I think anyway, if that's for 2, 3 hours. And it can be that if appendicitis is suspected, then seek immediately the doctor. And that is if there's pain for 2, 3 hours in the abdomen. And then the further steps are taken. And if it is appendicitis, then it is removed. Now, that was the medical part. If you were here for medicine, then you can go directly to the next part. I will do the backstretching. If you participate in the backstretching, then it's better here on risk. The legs are standing on the shoulder before the part, that we're breathing in and losing the outside. And breathe out over to one side. Breathe again into the middle. And out over to the other side. Breathe again in. And out into the middle. Breathe again in. Out over to the other side. Breathe again in. Out into the middle. Again in. Out to the first side. Breathe again in. Out into the middle and the arms down. Next exercise, now one sees the acroptria. Breathe in. And out, one hand slides down the leg and the other shoulder stays down. Breathe again in. And out, and we're taking one arm over. Breathe in and out, middle cage. Breathe out, back into it. Breathe again in. Out, one hand slides down the leg and the other shoulder stays down. Breathe again in. And out into taking one arm over. Breathe in and out, middle cage. Out into the middle. Now, aeronautic aerobatic aeroplane, the feet are sitting together. Breathe in, lift the arms up. And breathe out, one hand comes down. Breathe in and reach in both directions. And breathe out, one hand comes up. Breathe again in. And out, and one hand comes down. Breathe in and reach. And breathe out, one hand up. And out, one hand down. And now we're doing clap in the morning. The legs wide apart. Our shoulder wide. And breathing in the arms up. And breathe out, draw our shoulder blades together. And up, chest to the sky. Breathe again in, lift the hands. Breathe out, and again back. And in and up. Now overcross your arms, intertwine the fingers and reach high. Breathe in with screw. Breathe out, release. Change the position of the arms, intertwining in the fingers. And breathe in and reach high. And breathe out and release. Now change the position again, overcross. Breathe in, reach high. And breathe out and reach in front, the trail. Follow back. Again in the arms up. And out again, the crab in the morning. Drop the shoulder blades together, the chest to the sky. Breathe in, overcross your arms, intertwine the fingers, reach high. And breathe out, reach in front. Again in. And out the arms up and down. And we're ending with the sky hugger. Feet are standing together, we're reaching in the arms up. And breathe out, lean back, open the arms to the sky. Breathe in, lift the arms. Breathe out, lean again back. Breathe in, lift the arms. Out and bring them down. And we're ending with a cactus collecting its stings. Breathe in, lift the arms up. Close my hands and lower my hands down. That was backstretching. Thank you very much, and until next time.